Good afternoon. I'm Alan Unell, and this series of videos is called Healthcare Reform Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Before I go too far, down below in the description section will be a link to a news article from Healthcare Advocacy, which is essentially the text for today's video. In there will be all of the links I talk about, together with the action that we'll have described later. The action will also be separate in the description box. Okay, let's get started. Today is Medicaid. Medicaid is a joint program between the federal government and individual states to provide health insurance for low-income people. The federal government picks up most of the cost of the program. The program is overseen by the Center for Medicare and Medicaid Services, CMS, which is within the Department of Health and Human Services. Now, at the height of the COVID-19 pandemic, about 94 million of us got our health insurance there. That's huge because we only have 330 million in the US. Since the pandemic is over, that number has dropped to about 84 million because Medicaid grew during the pandemic to make sure that more people could have insurance. Anyway, there is a link to an article I wrote about a week ago in the newsletter, and what you'll see is that people have been pulled off or disenrolled from Medicaid. It's about 10 million so far, and at least 5 million of them have completely lost their insurance only due to administrative problems. That is, they didn't verify the address, or they didn't answer the mail in time, or there was a typo, or they didn't pick up the phone. And that includes, get this, 1.8 million children. All right, anyway, you can check out that article at your leisure. Each state decides how Medicaid will work for them. It's really a laboratory of 50 different ways to provide access to health care. Of course, some work better than others, and prescription formularies actually vary from state to state. State legislatures decide what prescriptions they're going to cover. It is incredible. Anyway, that can actually be deadly depending on the state you're in. And if you want to read T.R. Reid's book, The Healing of America, he provides a good example of that. Anyway, when the Affordable Care Act became law in 2010, the federal government offered to expand Medicaid availability to people whose incomes were up to about 138% of the federal poverty level, and they were going to include adults that didn't have children. It's a pretty generous offer. The federal government was going to pick up almost all the cost for new enrollees for several years, so that by 2020, states would only be paying 10% of the cost for the new enrollees, and that's going forward. They only pay 10% for them. In comparison, the federal match for traditional Medicaid populations varies from state to state based on per capita income, and it ranges from about Mississippi getting about 78% to 50% in New York and Alaska. This means that most states pay somewhere between 25 and 50% of the cost of Medicaid. That's considerably higher than what they would pay for people for a population that's covered under the new expansion. Anyway, the reason I'm writing the article or giving you this video is that I read an interview with the Republican governor of Louisiana recently. Now, Louisiana is one of the 10 states that have chosen not to expand Medicaid. States get to choose. The governor said he did not want to incur the extra expense of more enrollees. Compared to other states, Louisiana has the 8th highest death rate, about 1,056 people out of 100,000. And the top 2 causes of death are cardiovascular issues and cancer. And it also ranks, get this, 49th in life expectancy, 73.1 years. There are some states in the U.S. that are as high as 78 to 80. It's not good. Anyway, that's according to USA Facts, and that link is also in the newsletter. When I read the comment by the governor, I was reminded of a conversation I'd had with Adam Schiff years ago. Representative Schiff. He actually used to be my representative in Congress. When he described sitting in the Burbank Mall on an afternoon just waiting to talk to constituents. And one constituent came by and told him, you know, if you can't afford health insurance, then you just deserve to die. He said he was shocked when he heard that. But then he listened for it, and he heard it over and over again over the years, but always off the record. From a lot of people. That's actually economic eugenics. Hold that thought, because that's one of the horrible results of not having universal health care. Anyway, since covering more people with expanded Medicaid sounds like it might really cost more, there's an organization that researches healthcare policy issues called the Commonwealth Fund, and they investigated how states were doing with Medicaid expansion in 2020. Now, it turns out that even though the Affordable Care Act was passed in 2010, due to court issues and the like, expansion didn't happen until 2016. So, 4 years after expansion took place, they decided to take a look at the data. And according to the data, states that expanded eligibility for their Medicaid programs reaped significant savings, both within Medicaid and in other areas of the budget. So they're like saving money all over the place and covering more people. Their study, the Commonwealth Fund, complemented a growing body of evidence, and there's a link to that evidence, that Medicaid expansion gives people greater access to care, made more affordable for them, and is also saving the states valuable resources. An analysis of data from the National Association of State Budget Officers shows expansion increased total Medicaid spending from 2015 to 2019. You would expect that because you're covering more people, but state Medicaid spending decreased or remained flat over the same time frame. Additional analyses of state Medicaid spending found that expansion was associated with a 4.4 to 4.7% reduction in state spending on traditional Medicaid. There's a link to those findings that you'll see in that newsletter. Okay, historically, many states have supported programs for services for the uninsured. Now, this is outside of Medicaid. Mental health, behavioral health, public health programs, healthcare services for prisoners, you didn't think of that one, state general fund dollars, that's what pays for all those things. Now, with expansion, lots of the beneficiaries of those programs get to be enrolled in Medicaid coverage in the new adult category, which means the states can fund those services with enhanced federal, not state dollars. They also get revenue gains because many states are allowed to raise revenue through assessments or fees on providers and or health plans. It's not uncommon when you check out of a hospital that there is a small tax associated with a stay in the hospital that goes directly to the state to help pay for Medicaid. Anyway, as provider and health plan revenues increase with expansion, this also translates into additional tax revenues for the states to help pay for their Medicaid portion. They make money. Okay, summary and action. Medicaid expansion saves states money overall. By insuring more people, they're able to lower their overall expenditures, save taxpayers money, and still insure more people. I think that if you live in any of the 10 states that have not yet expanded Medicaid, you might want to let your representatives in the legislature and your governor know that they can save money for the people of their state by insuring more people expanding Medicaid. Now, here's a list of those states: Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming. And if you go to the description box or to the newsletter, I have a link where when you put in your address, it'll take you to the contact information for your state representatives. Now, here is a sample text that you can send to them, and there are links in there, and so it's a good idea to put those in. I'm your constituent, And I just learned that states that expand Medicaid save money in their total state budgets. An analysis of the data from the National Association of State Budget Officers shows expansion increased Medicaid spending, but state Medicaid spending decreases over the same time frame of 2015 to 2019. Additional analysis shows that expansion was associated with a 4.4 to 4.7% reduction in state spending on traditional Medicaid, and there will be links to all of those things you can put in your email. Long story short, cover more people, save the state money, improve public health by giving people access to health care and thus further reducing expenses. I want you to give this money-saving, life-saving capability serious consideration for our state. Thank you. That's what I've got for you. Like, share, subscribe. You can subscribe to Healthcare Advocacy, the daily newsletter. I look forward to talking to you next time.